Welcome back today. Today we're going to be talking about how to assist your doctor during a telehealth or telemedicine visit. So the first thing is make sure that the equipment you're planning to use is working properly. If your device is a cell phone or tablet, make sure the battery is charged. You don't want it to run out of power during the visit. Check to verify that you're able to use teleconferencing applications such as FaceTime or uh, Skype or some other type of teleconferencing software to make sure that your microphone and your speaker on your device is working. If it's a PC, test it out. Make sure that, again, your microphone and your speakers are working properly. That during the visit is not the time to find out you've got technical problems, and it either makes the difficult, makes the visit less productive, or ruins it altogether. All right, assuming your technical issues are solved and you've optimized the technology, there's things that you can do in preparation for the visit, which will be extremely helpful. So you can obtain a weight. So get a weight, use your scale. Even if your scale isn't perfectly accurate, at least you can use it. If you're using the same scale, at each time you weigh yourself, you can at least check your weight change relative to the same scale, which is still useful information. Take your temperature. Make sure you have a working thermometer. Make sure you tell the doctor which kind of thermometer you used. Was it oral, rectal? Was it axillary? Did you use obtain it in the ear or on the forehead? How exactly you measured it so that the doctor can interpret the number that you give him properly. You can measure the pulse, the heart rate. How to do that, if you've never done it before, you on the thumb side, let me line this up properly, you'll feel two tendon or cord-like things coming down here, and my finger is between those two cords right there. So if I take two fingers and I press very lightly over the surface and then slowly, gradually increase the pressure, I'll start to feel pulsing. At the moment you feel the pulsing, don't hold it at that pressure. Don't press any harder or lighter. And then using a clock or watch with a second hand, count how many pulses you feel in 15 seconds. And then multiply by 4. And that gives you your beats per minute heart rate. It's not hard to do. And if you're doing it before the visit, it takes no time. It's basically give them the number, 80, 60, 100, whatever you measured. The other thing that you can tell, was it regular? Was it beat, 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 beat? Or was it something like beat, 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 beat? That's irregular. So what was the pulse rate, and was it regular or irregular? Okay, respiratory rate. So basically, that's how many times breathing in and out is one breath. So simply count how many times you're breathing in and out in a minute. And simple thing to do, you just look at the chest movement and time it and record the result. Now, there are certain things that during the physical examination the doctor may want to do, and he'll need your help. So if you have a flashlight, or a pen light. I have this little one for purposes of this video handy. You may want to look at your throat. Well, no big deal. So you turn your flashlight on, put your mouth up there, look in your own camera what you're doing. Shine the light in. If he wants to look up your nose or wherever else he needs to see, do the same thing. He can see that. He can tell if your throat's red, if there's pus on your tonsils, if the tonsils are enlarged, whatever. A whole bunch of things. So something available. But you have to have your flashlight there. And ideally, you'd have a flashlight that has a narrow directed beam so that the light isn't bouncing off your face, and that backlight of the reflected light off your face is making the throat look real dark. You want the throat to look bright and nothing else. So you want to have a very narrow beam flashlight if possible. A pen light usually would work ideally. So the other thing you can use the flashlight for, sometimes in looking at rashes, you can just hold your skin wherever the rash is up to the camera. But sometimes if you shine the light across the skin, you can find out how elevated lumps are. And it can make the rashes jump out at you better. So just another thing to be aware of. You can, if you need, let's say there's something going on in the ear, it's bothering you. Well, this isn't an otoscope, but you could shine the flashlight inside an ear canal, and at least the ear canal part of it could be visualized over the video conference. Okay, so let's move on to the chest exam. So we measured heart rate by feeling pulse, but you can also put your hand over the heart and feel the heartbeats. You can listen over the chest, either putting your ear against the chest or using a stethoscope. Now, many people have a stethoscope for various reasons. Maybe they're a nurse or a medical technician or a veterinary technician. But it wouldn't hurt just to pick up a cheap stethoscope and have it there. It's not like you went to medical school for 4 years and 3 years of residency and training, but there's certain things you can tell without that. So you put the stethoscope on, assuming you have one. The earpieces should go towards the front, towards your nose, in a sense, not towards the back. So you put them on. Then you have to make sure that your diaphragm or bell, you have it turned and tap it to make sure you have it set correctly. Otherwise, you won't hear anything if it's not set to the surface you're planning to listen to. So I'm going to set this to the diaphragm. I put it over my chest. And when you do it, you should put it directly against the skin, although it will work through thin clothing. And then you can report back what you hear. Okay, so what are you going to listen to? Well, if there are normal breath sounds there, you're just going to hear air like wind moving back and forth with breathing in and out. But there are certain sounds that might jump out at you that are different. And so, for example, a wheeze. A wheeze would sound something like this. So if you hear that, that's not just wind and air moving by. That's a whistling sound. So if you hear it, you say where you heard it, how loud it sounded, and where you heard it, and did you hear it while the person was breathing in or breathing out? So that's useful. And some of the stuff you can do even be actually better to do it even before the call. So you could collect all this information and speed up make the telemedicine visit even more efficient. You can be listening over the heart. Another way to get the heart rate and to tell whether it's regular or not. Again, you're not doing diagnostic cardiology here. You're not determining exactly which form of congenital heart disease the person has, but you're providing useful information. Another sound that you can detect is called rouse. And to do that, to know what that sounds like, you just take your hair near your ear and you twist it like this slowly. And when you do that, you're going to hear this really fine crackling sound. That's exactly what the rouse sound like. So you listen, and if you hear that, you report that and say, well, I heard rouse on the left side in the back. Wow, that's useful. The person's got pneumonia, and you just diagnosed it. Again, you didn't have to go to medical school to do that. Okay. The next thing is a thing called Rhonchi, and that sounds sort of like what I would refer to as a rattle, and it's sort of like a sound like something like that. And it may be quieter, rougher, whatever, but let's say you're not hearing that when the person's breathing, but you put your stethoscope on the chest and you hear that in certain areas. That's significant. And that suggests there's fluid in certain areas of the lung, or at least in the airways of the lung. And that you heard it and where you heard it is important, and you can report that. Okay. Next tool, tape measure. So sometimes there's going to be an area of swelling on the body, a rash, a cut, or whatever, and we'll want to know how big it is, the diameter, length, width. So you just have a tape measure that has both inches and centimeter markings on it, because normally physicians record these measurements in centimeters. So you say, well, I've got this cut that's 3 centimeters long and we'll say half a centimeter deep. Or I have a lump or an area of a swelling that's 4 centimeters on my left thigh. And yeah, you could show that over the camera with telemedicine, but I can't tell for sure how big it is. If I were in the office doing the physical exam directly, I would measure it with a tape measure. So measure it with a tape measure and tell the doctor how big it is. Okay. So other kind of things will be directed by your doctor. So for example, if there's some question about something going on in your belly, you're having some belly pain, he wants to know, is there something serious going on, like appendicitis? Well, he's going to ask you to push on the belly. And when you do that, does the belly feel soft and just go in? Or does it feel hard, like you're pushing against the board? Does it hurt more as you're pushing in or when you suddenly release? The significance of these findings is important and will help the doctor to know what's going on. If it hurts as you're pushing in, what area of the belly hurts the most? Is it on the right side, the left side, upwards, downwards, whatever? And does it hurt more when you push in or you let go? So again, important information that you can get. The doctor may direct you to do certain maneuvers on the extremities, flexing, extending them, testing strength, balance, or whatever, coordination. Simply follow the instructions. So the point being, simple with a simple smartphone, you can do a heck of a lot, and you can assist the doctor in having the optimal amount of information if you come prepared for your telemedicine visit with your equipment ready. You've optimized which equipment you're going to use to get the best picture. You want the clearest resolution. If I'm doing a televideo conference and the resolution is very poor, I can't see things clearly. and so that limits how much information I can get. But if you've got a sharper camera, maybe your smartphone's got the sharpest camera. Maybe your webcam on your PC's got the sharpest camera. Whatever. Maybe your girlfriend or your mother's got the best camera. Use the equipment that has the highest resolution, so that the doctor can see most clearly with it. I hope you find these tips useful in making your telemedicine visits more productive. Thanks for watching.